If your child routinely complains about their stomach and every doctor visit ends with everything looks fine or they'll grow out of it, you're not alone. Those symptoms point to something real, measurable, and fixable. It's called SIBO, small intestinal bacterial overgrowth, and yes, kids can have it too. Let's start with what matters most, the facts and the fix. So even if you only stay for a minute, you're going to leave with value. If your child is struggling with daily belly pain, bloating, or constipation, some of the more common symptoms that are linked to gastrointestinal dysfunction, but there doesn't really seem to be a definitive reason for why that is, and maybe those doctor's visits aren't being productive and you're not getting answers, well, it's very often that this is SIBO, small intestinal bacterial overgrowth. And as the name implies, it's an overgrowth of bacteria in the small intestine where there really shouldn't be that much bacteria or other microorganisms, period. So that could be what you're looking at. Well, what's the fix? Well, you could look at antibiotics, but maybe you don't want to go that route. And if that's the case, if natural antimicrobials make more sense for you or are at least something you would rather try at the outset with your child, well, some of the ones to consider here are going to be oil of oregano, garlic, caprylic acid. These tend to be some of the more gentle antimicrobials, herbal options, if you will, although caprylic acid is not an herbal. And the other thing that you would want to do is you would want to do what is called supporting the gut terrain. Essentially make an environment that is not hospitable for an overgrowth in the small intestines. And you may even introduce some probiotics to help along with this. And if I could point you to one to look to, it would be Saccharomyces boulardii, one that's actually a beneficial fungus. And while most families never hear that this combination is an option from their doctor, it absolutely can be one of the simplest, most effective starting points, and it can go a long way in calming down the gut and helping to restore normal digestion for kids. Now, I'm just getting started here. And if you like what you've heard so far, well, go ahead and hit that like and subscribe button. And while you're at it, go ahead and make sure you leave a comment. I'd like to hear what your thoughts are on this. And you might as well stick around now that you're this far in so that I can help you recognize what some of the early signs of SIBO are and how to restore your child's digestive health naturally. And if you've never watched one of my videos before, well, allow me to quickly introduce myself. I'm Dr. Arland Hill, and I'm both a clinician and a rancher. And for the last 25 years, I've been helping families just like yours regain their health by implementing lasting solutions that put food and movement first. It's also why I started Harvest Hills Ranch, which is where I produce transparent food. And that's not just a tagline, that's actually who we are. Let's begin by exploring this problem a bit more. Why does your child develop SIBO in the first place? Children develop SIBO, frankly, for the same reasons that adults do. And in the case of a kid, however, the difference is that the impact can be much more profound. It can have much more lasting effects, even into the adult years, if not addressed in an early enough time frame. Quite frankly, you're still dealing with a stage of life where the digestive system is still developing, and if the digestive system is not optimized, then all the other systems of the body aren't getting the nutrients and the nutrition that they need to fully develop as well. So let me point to a few reasons here to be more specific on this, because some of the reasons that we would see with adults would be lack of acid, lack of enzymes, lack of bile production, or slow motility. You could think about conditions where you, say, for example, hypothyroidism, chronic stress, chronic inflammation. These are all factors that could be associated with why this happens in adults. But one other area that overlaps with adults that I think probably doesn't get enough recognition here is going to be children on their own prescriptions. And acid blockers, just like acid blockers are a problem in adults, acid blockers can be a problem in kids. And when I say I don't think it gets enough attention, my point here is that it's often recommended that if a child, and I've seen some pretty early stages of life where this is a recommendation for reflux, And that child, rather than looking into what the cause of that reflux is put on an acid blocker, and that acid blocker is going to have the same effects that it does in adults. You're impacting digestion of food, so just really at the superficial level, but you're also impairing the ability to assimilate, whether it's macronutrients like protein or whether you're talking about micronutrients like B12, zinc, selenium, iron, along those lines. Those are all going to be impacted. You add to that 34% of individuals, of children, let me be specific because that's our topic today, 34% of children, according to the data, are going to end up with problems that are put on an acid blocker. And that's just, when we define problems here, we're not just necessarily looking at nutrient deficiencies, we're talking about the onset of infections. So it could be, say, for example, an infectious diarrhea. Clostridium difficile infection can occur as a byproduct of a kid being on acid blockers, and that's a very significant infection that we're talking about there. You can also see development of respiratory issues, and of course our topic today is SIBO, small intestinal bacterial overgrowth. These are all byproduct of a kid being put on these acid blockers at a very early age. And imagine if that allows for the onset of SIBO in let's say it's in year 2 of life, and now you've got the rest of childhood, adolescence, all those developmental years that are potentially being impacted if this is not recognized and turned around and corrected. In addition, the reality here is that you're also dealing with constipation in a lot of these kids because of poor dietary habits, just not necessarily just the food that they're consuming, maybe being a poor food choice, but the lack of a good solid routine with their dietary intake could also be a player in this. And keep in mind that when we're talking about the bacteria overgrowing in the small intestine, this is literally a scenario where they're stealing nutrients. They're utilizing those nutrients for their benefit, and by so doing that, they are not allowing those nutrients to be taken in by the host, by the human, if you will. And that leads to not just poor nutrient absorption, but you're going to get into vitamin deficiency, minerals deficiency, protein deficiency, all these things that you can see with labs. And keep in mind, at the end of the day, the real problem here is that those nutrients are no longer reaching the cellular level. And if the cells don't have those nutrients, the cells can't carry out their normal functional roles. And that in turn leads to deficit, dysfunction, stunted growth. I'll talk more about that momentarily. But those are all factors that have to be considered. And it may begin with something as, just an observation of chronic bloating and distension or ongoing constipation, kids sitting on the toilet for extended periods of time, complaining that their stomach hurts when they are sitting on the toilet. These could all be red flags that need to be looked further into that could be pointing back towards SIBO. And I did want to talk about the stunted growth because this definitely does happen, and studies show that up to 90% of children with stunted growth also test positive for SIBO. So that's not some just random connection there. There's definitely an association there that needs to be, at least at a minimum, investigated. It would make sense logically for all the things that I said, based on if you don't have those nutrients then you just can't thrive, you can't develop like you need to be able to. But there is a direct link between small intestinal bacterial overgrowth and the inability to grow, to focus, and just frankly to thrive. And it's often just dismissed as, oh, my child's a picky eater, or this kid has anxiety, or some other neuropsychiatric disorder, or it's just a part of growing up. There's all these excuses that are given for not digging in and looking further, when really just looking at these symptoms and matching it up with what the probabilities are of what that child is dealing with could point you very heavily in the direction of SIBO. Not everything is SIBO, but it's very probable that that is going to be an option for many individuals or many kids. And, you go back to looking at something like stunted growth. Stunted growth is not a part of growing up. So these excuses they just don't make sense. They don't hold water. And, if you think about what's actually being stunted, remember, it's not just physical stature that's being stunted. It's all the other facets of development. It's neurological development. All these other components in the developmental process are being affected there. So when a child's microbiome is imbalanced, everything from appetite to sleep to attention, all of those things are going to suffer. We should probably investigate why SIBO gets missed. And a lot of families end up spending months or even years chasing some of these symptoms that are associated with SIBO and not getting answers. And some of the reasons that this can get missed, or someone doesn't get the resolution that they're looking for, kids not getting resolution, some of those reasons are going to be things like, taking probiotics that don't help. And the idea here is that you're taking a shotgun strategy with the probiotic, assuming that the probiotic is going to restore the issue when you really haven't defined what the issue is and tried to align the probiotic, the best probiotic, to what the issue is. So that's one thing. Restrictive diets. Restrictive diets, honestly, a lot of times, in my observation, make things worse. And they just seem to be so prolifically used, and they're not substantiated. And I think in the context of a kid, where the bigger issue here is that they probably create even more challenges, because now you're starting to develop food aversions. You're taking generally someone's palate that's not as diverse and expanded as an adult's is, and you're making it even more difficult for them. And there's just a lot of, basically what you're doing is you're starting to tap into, in a negative way, the psychiatric part of eating, that we don't want to harm that. We want to have some liberties with eating, but just point kids more in the right direction of the better foods to consume, as opposed to being too restrictive with the dietary intake. And then just constant reassurances that it'll grow out of it. You think about that and telling someone, like, if you've ever been told, oh, it'll just get better, and it doesn't get better, that's not a helpful approach. So those are the types of things that are often leading someone in the wrong direction, leading a kid in the wrong direction. And keep in mind, too, that when SIBO is present and you're using an over-the-counter management, or it's a symptom management type of approach, it's not going to work. And the reason it's not going to work is because you're still dealing with the continued overgrowth. And that continued overgrowth is overshadowed by digestive secretion imbalances, nutrient deficiencies, impaired motility. These are all things that have to be dealt with, and not just tossing an intervention or a supplement as something, expecting that there's going to be an optimal outcome. But before you have despair here, let me propose to you that there is a natural correction plan to this that you can take action on. And for those of you that want to go the conventional route on this, by all means, go the conventional route. You can use rifaximin as an antibiotic. There's other antibiotics that can be used in the pediatric SIBO cases as well, if that's something you want to do. If you feel like you need to go with a FODMAPs diet or probiotics, hey, then go that route. No one's telling you not to do that. But I do have some good news for you here too, is that you don't need the harsh drugs, and there is a better way than like I said earlier, than that restrictive dietary strategy. And what this does is, this approach, this natural lasting solution, comes down to a 3-phase approach. And the first step is going to be gently reducing the bacterial load using natural antimicrobials. Now, I'm saying it that way specifically because when we talk about an adult, my strategy with an adult tends to be to use more aggressive botanicals or herbals, if you will, and to use multiple of these at the same time to try to generate the outcomes, because we've seen that the most positive studies in the literature that have used botanicals, used herbals, that's the way that they generated the outcomes that they did, and that's how they were so successful. But sometimes those options don't work in a child, especially if we're dealing with someone who can't handle tablets. So I do still like the idea that multiples are better. So rather than depending on a single antimicrobial here, a single herbal, if you will, you're going to be better off depending on multiple herbals at the same time. And some of my favorites on this that I do employ in this category category of patient are going to be olive oregano. It is absolutely safe and it's very easy to administer. So you've got that working for you. The next one that I like to use is going to be garlic extract. So allicin being the active constituent there. And this is absolutely one of the best broad spectrum antimicrobials. It's also very safe. You'll notice that these are things that you could find in your kitchen. And the reason that with the broad spectrum nature on this is that you're likely dealing with multiple types of bacteria, and you're also potentially dealing with other organisms besides bacteria. There could be a fungus in there, there could be archaea in there. So these are all organisms that can and will succumb to the presence of garlic. And then the one that is on my list that's not an herbal is going to be caprylic acid. This is actually what's called a medium chain fatty acid. It's found in coconut. That's where it's derived from. But one of the things I like about this is that it can help with your disruption of your bacterial biofilm. So if these bacteria have some type of protective biofilm around them, caprylic acid is an intervention that can help offset that. And then the probiotic that I like in these strategies or in this phase, we're still talking phase 1 here, is Saccharomyces boulardii. I mentioned that earlier that I have a preference for that one, and again, I'm mentioning it here. So that's the one I would recommend to lean into. That's phase 1 though. Phase 2 is you need to address the digestive secretions and motility. So this is your acid, your enzymes, and your bile. And these are truly the cause of SIBO. When you deal with these underlying causes, this is when you're going to get to the bottom of SIBO, and you can't just take this approach of, I'm just going to throw supplements at it. You need to know what you're dealing with. You need to know why you're dealing with it, what caused it, what put it in place, so you can target that as well. And when you deal with the digestive secretions and the motility, that's going to address phase 2. But remember, there's a third phase here too, and this is going to go back to what I talked about in regards to where the nutrients are going. And this phase 3 in kids may be the most important of these 3 phases. They're all important, so don't get me wrong on this and think that you can only do one. You've got to do all 3. But I say that because when you look at how profound the impact of these nutrient deficiencies are, you want to make sure that you're restoring these nutrients. So it's always best to define which nutrients are needed. You know, we could always say things like the B vitamins, the minerals, the fat-soluble vitamins, your protein in the diet, potentially your fat. Those are all likely affected in one way or another. Pretty comprehensive list. But it's best to always try to define that as much as you can, because that's going to allow you to replete those nutrients in a balanced approach. You can use blood tests, lab tests to be able to help accomplish that, but I do recommend that pretty strongly for when it comes to nutrient restoration here. This also should be matched up with a strong dietary component where you've got good real food, naturally nutrient dense food that's going to help drive that healing component as well. So if a structured plan like what I'm sharing with you here feels like what you need, then I can help walk you and your child through it. Or if you just want to start on your own, but you feel like, okay, well, I probably do need a little bit of a roadmap, then follow the link down in the description below for the SIBO solution. It'll help you accomplish that. If your child's gut symptoms have become part of everyday life, don't assume that that's normal. SIBO isn't an adult-only condition. It's showing up in kids more than ever. But the good news is that when you identify it, it's absolutely fixable. So if this has opened your eyes about a possible missing link, well, go ahead and again, give this video a like and a share with someone who you think could also benefit from this. And if you want to understand how SIBO connects to your own digestive terrain, I mentioned that a little earlier, well, go ahead and watch my next video here, why SIBO keeps coming back and how to fix the terrain once and for all.